The shadow of HIV, understanding the symptoms of HIV virus and its impact. HIV, the human immunodeficiency virus, is a relentless silent threat that continues to cast a shadow over millions of lives worldwide. While its name might sound technical, its impact is devastatingly human. This virus attacks the very foundation of our immune system, leaving us vulnerable to a host of opportunistic infections that would otherwise be easily fought off. The initial stages of HIV infection are often marked by a flu-like illness. Fever, chills, muscle aches, fatigue, and swollen glands are common symptoms, easily dismissed as a temporary ailment. This period, known as the acute HIV infection, can last for several weeks, leaving many unaware of the virus quietly taking hold. It's important to understand that even during this early phase, the virus is already replicating rapidly, establishing itself within your body. The period between contracting HIV and developing detectable antibodies is called the window period. During this time, a person can still transmit the virus. Symptoms during this period are often mild or non-existent. Flu-like symptoms: fever, headache, fatigue, muscle aches, sore throat, swollen lymph nodes especially in the neck, armpits, and groin, rash, night sweats, diarrhea, mouth sore. These can occur on the tongue, gums, or inside the cheeks. Skin rash. This can be a red, itchy rash that appears on the body. Nail changes. Fingernails and toenails may become brittle or discolored. Weight loss. This may be unexplained and occur even if a person is eating a healthy diet. It's essential to understand that many people experience no symptoms during the window period. The symptoms are often mild and can easily be mistaken for other illnesses. These symptoms can last for a few days or weeks, and then disappear. As HIV progresses, it enters a stage known as asymptomatic HIV infection, a period of seemingly good health, often spanning several years. This lull can be deceptive, as the virus is actively attacking and depleting your immune cells, setting the stage for future complications. This is also the period when HIV is most easily transmitted, as the viral load in the blood is high. The insidious nature of HIV is evident in the way it gradually erodes the immune system. This erosion creates a vulnerability to opportunistic infections, illnesses that normally wouldn't pose a threat to those with a healthy immune system. Pneumonia, tuberculosis, certain types of cancers, and fungal infections become more prevalent. The later stages of HIV infection, characterized by severe immune deficiency, are termed AIDS, acquired immunodeficiency syndrome. The symptoms of AIDS can be debilitating and life-threatening. Wasting syndrome, a significant loss of weight, is a common sign. Chronic diarrhea, persistent fevers, and severe skin infections also become frequent. These symptoms are often accompanied by cognitive decline and neurological complications. HIV diagnosis is crucial to manage the virus and prevent its progression to AIDS. Regular testing is highly recommended, especially if you engage in risky behaviors, have had unprotected sex, or have shared needles. Early diagnosis is essential, as it allows for the initiation of antiretroviral therapy, ART, which effectively suppresses the virus and significantly improves the quality of life of individuals living with HIV. ART, a combination of medications, has revolutionized HIV treatment. It doesn't cure the virus, but it effectively controls the virus's replication and slows its progression. People on ART live long, healthy lives and can reduce the risk of transmission to others. However, the battle against HIV is far from won. The stigma and discrimination surrounding the virus remain a significant barrier to testing, treatment, and prevention efforts. Lack of access to health care, especially in marginalized communities, continues to fuel the epidemic. We need to actively combat these challenges. Open conversations, increased awareness, and continued research are crucial. If you haven't already, please subscribe to this channel to stay updated on the latest developments in HIV research and treatment. Together, we can empower ourselves with knowledge and help reach the goal of 30,000 subscribers by the end of this month. Your support is vital in amplifying this message and making a real difference in the fight against HIV. If you are at risk of contracting HIV, it's important to take steps to protect yourself, such as using condoms during sex and avoiding sharing needles. Getting tested. The best way to know if you have HIV is to get tested. Early diagnosis and treatment are crucial for managing HIV and preventing its progression. HIV may be a silent threat, but with knowledge, compassion, and collective action, we can create a future where the shadow of this virus gradually fades.